Remind you that starting on Monday, I'll only be doing these press conferences 3 days a week, Monday, Wednesday, and Friday at 1 o'clock. I have been asked by folks, does that mean we're working less on the coronavirus? No, it does not mean that at all. We still have a 24/7 operation to keep Rhode Islanders safe, but we are in a different phase now where we are not out of the woods, but also not living the daily crisis that we once were. It's still incredibly important that you tune in, that you get your information. Next week, we will have actually a number of very important announcements. But I just decided we're in phase 2 now, and it was okay and appropriate to go to 3 days a week. So I look forward to seeing you on Monday at 1 o'clock and again on Wednesday and Friday. Thank you. Okay, we will begin, as we always do, with a picture of the data. I want to take a second to thank my data team. We've all become accustomed, myself included, to having the most accurate data at our fingertips. This is hard to do. It is hard at the end of every day to collect the data from the hospitals, collect data from nursing homes, collect data from cities and towns, every testing site all around the state. And it's a great credit to the folks who are working hard to make this happen. So I want to say thank you. As you can see from the data on the screen, yesterday was a good day. It's actually a very good day. We tested nearly 4,500 people. That's a record. That's a testing record. Nearly 4,500 people tested in the state of Rhode Island. It's the most we've ever done in a day. That's fantastic. And we saw a test positive rate of just below 3%. So that's excellent. We're testing thousands of people all over the state, and the test positive rate is the lowest it's ever been, less than 3%. We are reporting today another 113 new cases, and very sadly, another 16 fatalities. We will continue to every day track. We will continue to keep you updated. We will be prepared to make changes as necessary if the data changes. But right now, we're in a very stable place, and I feel excellent and confident that we are doing the right thing by reopening our economy and moving ahead as we are with phase 2. The other day, I was asked at a press conference about some of my executive orders that were expiring, and I want to take a minute to tick through a few executive orders to let you know which ones I'm reinstituting or renewing. So a month or so ago, I signed an executive order directing everybody in a public space, any public space, indoor or outdoor, to wear a face cloth covering, a simple face cloth mask. I have extended that executive order for another month until the 4th of July. So I am asking everyone, please, if you are in a public place, inside or outside, to have a face cloth covering. That is until July 4th via executive order. Now, I want to be clear about this. The guidance from the Department of Health is if you are able to maintain continuously 6 feet of distance with everyone around you, you need not wear a face cloth covering. So obviously you do want to use some common sense about all of these rules. If you are alone working in your office, you do not need to wear a face cloth covering. If you leave your office to use a shared bathroom, or you're going to go to a conference table or a room where you're going to be with some of your colleagues, then please make sure you put on your face mask. If you can be in a room where you can be safely and continuously 6 feet apart, you do not need to keep your face mask on. But this is designed, if you're at a restaurant, if you're driving through a drive-through, if you're crowded with people for more than 10 minutes at a time, you are going to want to have your face mask on. I will say we continue to see excellent compliance. In fact, last weekend, when we did our spot checks of businesses, we saw better compliance than the weekend prior. I think we're just getting used to it. It's an unusual thing to do. but we're getting used to it. And definitely, if you're in a restaurant or you're in a grocery store, you're in retail, getting your hair cut, etc., please have your mask. The way I think of it is, it's just like your phone, your wallet, your purse. You don't leave your house without it. Don't leave your house without your mask. There are a number of additional executive orders also that I have extended. I want to go through them quickly. A few months ago on March 9th, shortly after the first cases of coronavirus, I declared a state of emergency here in the state of Rhode Island. That state of emergency is still in effect. I have just again reissued that state of emergency until the 5th of July. So until the 5th of July, we remain in a state of emergency. I extended it for 30 days. Why are we doing that? It makes sure that we have access to all of the necessary federal resources that we need as we fight this crisis. Also, it just gives us the flexibility that we need in my administration to move quickly in order to make sure that we meet the needs of the crisis. The other one that I've extended until the 5th of July relates to telemedicine. Yesterday, I spoke at length about how I believe we have an opportunity now to reorient and rebuild and redesign our entire healthcare system. Part of that means a greater reliance upon telehealth. We've seen a lot of success providing healthcare to people through phone calls and video conferences, and we want that to continue. So I have issued another executive order through to July 5th as it relates to telemedicine, which directs all health insurers in the state of Rhode Island to cover telemedicine for primary care, specialty care, mental health care, and behavioral health care until July 5th. And that includes a simple phone call or a video conference. The executive order also requires reimbursement rates for providers to be the same for healthcare delivered in the office as they are for telemedicine. This has been critical to break down barriers to access. I want to thank the health insurers for their great work on this, and I want to thank providers. This is new for you. You've had to adjust your practices to enable this, and I want to thank you for that. I will say this new executive order ends July 5th. If I have to extend it after July 5th, I will. At the same time, I want to work with the legislature to make this permanent. We've learned there's a role for telemedicine, and it ought to be provided and paid for. And so I would like to work with the legislature to make this a permanent feature via statute so we don't have to do it month to month. A note about quarantine. This is very important, and I signed this executive order as well. As we begin to reopen the economy, go back to work, go back to living the way we want to live, it is going to be more important that we follow the rules. The mask wearing, the hand washing, 6 feet apart, all of it. One of those very important rules that I haven't talked about in a while is quarantining. Quarantining is a fancy way of saying staying at home. Stay at home if you're sick. So I want to reiterate with clarity the executive order, which is in effect until July 5th. If you have been diagnosed with COVID-19, you need to isolate until you no longer have symptoms. If you've been in close contact with somebody who's been diagnosed with the coronavirus, then you need to quarantine for 14 days. So what does that mean? If you live with somebody in your family gets tested positive, it means you have to be in quarantine, stay at home for 14 days. Can't go to work, can't go to the office, can't leave your house for 14 days. If the Department of Health calls you and tells you that you've been in close contact with someone who's tested positive, you must quarantine, stay at home for 14 days. This is a big one, it's important. The executive order related to quarantine and isolation is in effect until July 5th. This is also why I keep talking about contact tracing notebooks and using the Crush COVID RI app. If you have your contact tracing notebook and you get a call from a friend or a call from the Department of Health who tells you someone in your notebook that you've had close contact to now has the coronavirus, you must stay at home for 14 days. I also want to remind employers that your employees must stay home for 14 days. They cannot be punished for staying home if they're in quarantine. They should be paid sick leave if they're at home in quarantine. They should be enabled to work from home, but by law, if you're in close contact with someone with the virus, you need to stay home for 14 days. And by the way, if you're at home on quarantine, it's very important that you track your own symptoms. And again, I would just encourage you to use the Crush COVID app. There's a symptom tracker on there. You're gonna want to track your own symptoms very carefully in case you come down with the virus. A couple more quick announcements for today. It's Friday, it's been a long week, so I'll endeavor to keep this quick today. Earlier this week, I mentioned the United Way is leading a Be Kind Rhode Island statewide challenge. I've asked you throughout this crisis to be kind. I can't emphasize it enough. So I'm asking you, every Rhode Islander, myself included, my family included, my staff included, do something kind for somebody this weekend. Do something kind for somebody this weekend and then share it on social media with the hashtag BeKindRI. Could be simple. Send a text, cheer somebody up, deliver somebody groceries, call your mom, look in on a loved one, call somebody or face chat with somebody who's in a nursing home. Just do something nice. Hold your tongue when you feel frustrated. Be patient, be open. Do a kind act over the weekend, and if you can, post it on social media, hashtag BeKindRI. And thank you to the United Way. One act of kindness is great. A million is even greater, and this effort is meant to amplify the kindness, and I really think now more than ever it's going to get us through. Finally, I do want to take a second to address the Rhode Islanders who plan to participate in the protests this weekend. Today in Providence at 4:30, we're expecting a protest. Tomorrow, there'll be a protest at Colt State Park. I believe there's another one planned for Newport. Earlier this week, there was one in Woonsocket. So let me say this. If you plan to engage in one of these peaceful protests, I think that is your right. And I think at this moment in time in America's history, it's vital that you make your voices heard and stand up against injustices. It is, however, also vital that you be aware that we are still fighting a deadly virus. Coronavirus hasn't gone anywhere in the state of Rhode Island. It's still here. We've just learned how to deal with it and be safe. So I'm asking you, if you're going to go out and participate, wear your mask, bring some hand sanitizer with you, don't participate if you're sick. If you have a loved one who you live with who is sick, who is older, think twice before going, and if you do go, be extra vigilant. We will have folks from the Department of Health, actually lots of volunteers from the state, who will be at tables with t-shirts. They'll be passing out masks if you forgot a mask, passing out some hand sanitizer, providing you with information about the virus. We want you to protest. We want you to exercise your rights. We want you to stand up against injustice and be part of a movement that will bring about change. We also need to keep Rhode Islanders safe. And the virus is still very much with us. So I'm just asking you to be safe and, follow the rules. I also want to say this. Last weekend, there was a beautiful, powerful, meaningful, peaceful protest at the State House. It was peaceful. It, I believe, will lead to change. And there were people from all walks of life that were there, socially distanced, wearing masks. This moment calls for peace and activism. And so that is what we're going to have today. I believe these protests, everything I know is that these protests will be peaceful, and we're going to do everything we can to maintain the peace and allow people to exercise their right to protest. So with that, I'm going to turn it over to Dr. Alexander Scott and then come back to answer questions.
Thank you, Governor. Good afternoon, everyone. Thank you all for being with us once again. As the Governor said, we get started with the data. We have 113 new cases to announce today. There are 182 people with COVID-19 currently hospitalized in Rhode Island, and we have 37 people currently in the intensive care unit. 23 of those 37 people in the ICU are on a ventilator. Sadly, we have 16 additional COVID-19 associated fatalities to report today. 3 people were in their 60s, 3 people were in their 70s, 6 people were in their 80s, 3 were in their 90s, and 1 person was older than 100 years old. Our sympathies and our prayers are with the families of these Rhode Islanders whom we have lost. When Dr. McDonald was here yesterday on my behalf, thank you, Dr. McDonald, he referenced some guidance that the Rhode Island Department of Health was planning to share with nursing homes and assisted living facilities. We have shared in the past, as the governor has made clear, that phase 2 will continue to restrict visiting to nursing homes and assisted living facilities, but we said that we would use this time to prepare for a thoughtful, careful way to address this in phase 2. The intention of the document that Dr. McDonald referenced yesterday is to help facilities begin to think through and develop their own plans to allow for safe visitation. I do want to be clear that visitation is still currently not permitted in Rhode Island nursing homes and assisted livings now during phase 2. But we want to support facilities to start developing plans on how visitations can happen safely as we move towards phase 3. The document we shared lays out some considerations and guidance for facilities in many areas, including screening appropriately, distancing, scheduling of visits, the duration of visits, hand hygiene, and many other topics. Each facility is different, and for that reason, we're not taking a one-size-fits-all approach. What we're doing is giving facilities very clear guidance with clear parameters, and then asking them to develop plans that fit within that based on their own unique physical layouts, their own resident populations, and their own other factors. We will review facilities' plans in the coming weeks. I want to address one last topic. Earlier this week, and as the governor just shared, we mentioned that staff from the Rhode Island Department of Health have expressed interest in volunteering at peaceful protests at which people are making their voices heard about racial injustice. There will be volunteers from the department as well as community partners and others who want to join. Our aim is to ensure that when people are coming together to make their voices heard, measures are being taken to prevent the spread of COVID-19. We are going to be providing masks, encouraging social distancing, and making COVID-19 resources available. This is an example of the Rhode Island Department of Health acting on its mission, along with its partners, to help to address an immediate acute health issue in terms of COVID-19, and to also act on and address the structural issue of racism, which has broad impacts on health outcomes. As has been said, our vision in Rhode Island is that everyone has an equal opportunity to be healthy in Rhode Island, regardless of your zip code, race, ethnicity, sexual orientation, gender identity, and level of education. And that's why Rido, the governor, and our whole COVID-19 response team has made equity such a clear focus. For people who are planning to also be at demonstrations, and for everyone throughout Rhode Island, please continue to keep in mind the measures that the governor shared prior to heading out. First and foremost, as mentioned, stay home if you are sick. It's been a primary message, and if you have symptoms, it is important to stay home. Also, as the governor has shared, think about those who live in your home. If you live with an older adult or someone who has an underlying medical condition or someone else who is at higher risk, it may not be the best idea for you to be at a rally. There are many other ways for you to get involved that don't always involve being at a demonstration. If you head out, remember, keep a distance of 6 feet from other people, avoid physical contact, greet each other from afar, and signs can be used to get your message out. This is safer for all than chanting or yelling, since this can spread COVID-19 if you don't know that you have it. That's why we will be giving out masks, cloth face coverings, because that is key. And finally, if you have not downloaded the Crush COVID RI app, this is the perfect time to do that. We want everyone to be able to express themselves, particularly on certain topics as important as addressing racial injustice, and we want to make sure that people do so safely. With that, we'll hand it back to the governor and get us started with questions.
Governor, actions speak louder than words. Right now, outside this auditorium, there are barricades, National Guard, police with body armor and automatic weapons, helicopters, boarded up windows, phone alerts, parking bans, and curfews targeting youth of color, but not white diners. Some people are afraid to step out and protest today for fear that their behavior will be criminalized or worse. Protesters nationwide are talking about the excessive policing of Black bodies, and your response, despite very pretty words, is more policing of Black youth.
So I'm not sure who you're reading that from, but I'm happy to address it. The curfew, you have to ask the mayor, because he has imposed the curfew in the city. The barricades, when it came to my attention, that I don't think they were they were this morning put in front of the State House, and when I saw that, I immediately directed that they be opened, and if they're not now, they will be by 4:30, because we want, obviously, people ought to be able to protest on the grounds of the State House. It's an incredibly powerful symbol. So rest assured that by 4:30, they will be open and people will be allowed to, go to the State House. This is very difficult, okay? What we are trying to do is very difficult. We are trying to strike the right balance where we enable a peaceful protest during the day, never threatening anyone's right to do that, never policing against anyone who is appropriately protesting, including, yell. I know the doctor said not to yell, but exercising your rights. We also know that when it gets dark, it's possible that we could again be dealing with some serious violence, and we need to be ready for that. So you have my commitment, and I know the Rhode Island State Police is committed to this, and the Rhode Island National Guard is committed to this, to make sure that during the day today, people feel safe, and in no way is law enforcement going to interfere with or be heavy-handed with anyone's right to protest. Having said that, the helicopters you hear are doing surveillance, because we know that we're living in an uncertain time, and we need to be ready for what might come.
Dr. Scott, considering that we had the protests last week, or this week actually, and are expecting 2 this weekend, is there a model out there for when we might see a spike?
Yes. Usually if you have been exposed, it's about 10 to 14 or so days before symptoms begin to develop. Subsequent to that, as symptoms develop, that's when someone can get tested and be able to identify whether or not COVID-19 is what their symptoms are associated with. That's why we have that 14 to 21 days before we start to see any type of increase. It's also why the governor, when the governor mentioned the quarantine order that was explained earlier today, the reason for that, being able to stay home, is to monitor for symptoms. That's the key. If symptoms develop, you are already home and out of a public venue where the risk of spreading COVID or any other illness for that point is lower. So having that knowledge and understanding is helpful for people in general, and then those who participate in these types of events as well.
If I can just follow up, and with that in mind, is your department in the state, have you looked at that? Are you looking at a particular date where you're saying, we've got to be ready for this particular day?
Yes, that window of time that I've shared, about 2 weeks out from now. We want to make sure that everyone knows testing is available, particularly if someone's developing symptoms or if there's concern, and just encouraging people who participate to be vigilant about monitoring themselves and have a very low threshold for getting evaluated, getting tested. Make sure that you are keeping contact with who you are engaging with so that we can quickly respond if we need to. If people are physically distancing appropriately, wearing the mask that we want to have available to give out, and peacefully protesting, we feel like we could do what we need to in supporting this.
Governor, on the continuation of the emergency declaration, while some of it is to access federal resources, returning to critics who say you've overstepped your authority during this crisis, when do you think we will no longer be in an emergency? Do you have some sort of criteria for that? Mm-hmm. And at what point might you cede some of these powers? I believe you started today by saying we're no longer in a daily crisis.
Yeah, it's an excellent question. I don't know is the honest answer. The President Trump extended the federal funding and use of the National Guard until August 21st, which I appreciate. I think every governor appreciates. So I don't know, Brian. And throughout this crisis, I have to take it a day at a time. My answer is not a minute more than necessary. But as long as we are still heavily reliant upon the National Guard, heavily reliant upon FEMA, heavily reliant upon federal funds, we're still having to move on a dime to address certain issues. You know, as long as we're not out of the woods, then I will have to keep this in effect. So I don't know. I have no desire to do this any longer than is necessary.
Governor, is Providence? All right, Governor, is Providence open tonight? I mean, you go by, it's very jarring. You see the P-PAC is boarded up, Federal Hill is boarded up, Fox Point is boarded up. Is it open for a family that wants to come to Providence tonight to go out to dinner?
Yes, it is. The mayor's curfew begins at 9 o'clock. So that is in effect. But yes, absolutely. Absolutely. I mean, listen, I'm not going to pretend this isn't unsettling. As we sit here in PPAC, you hear the helicopters overhead. It is so unsettling. We've never lived through this before. So I would say, but they're there for our security. So yes, absolutely, you should. There's a lot of businesses who are afraid. They're boarded up because they're afraid, because the other night we had a horrible night. There were people who came to Providence with the express goal of setting on fire and destroying a lot of these small businesses. So I can't fault these businesses for putting up the, bordering their windows. Having said that, yes, absolutely, is the answer to your question.
We all received on our phone the public safety alert, and it mentions Providence. Are more of these going to go out during the course of the day, and how did that decision come about? Is that set by the state or by the city of Providence?
Can you help?
Yeah, sure. So that's a notice that went out by the city of Providence, and And that's a decision that was made by presumably the city and their emergency management agency. And they have the ability through their emergency management agency to push those kind of alert notifications. So we don't know of any future plans for those alerts, and it wasn't generated out of our office.
Was it just people, now we're in Providence, did I receive it because I'm in Providence, or did that go out statewide?
I can't speak to exactly how they targeted, but I know how those alerts work, is that you can do a geography for a delivery of the message. So that would be my presumption.
Director Smiley, Governor Raimondo, and Director Alexander Scott, a question for each of you. Will you be out there at the rally today, 4:30?
I believe they are. Yes, right? Yeah. I don't think I am gonna be able to go. At 4 o'clock, I'm spending my entire day, most of the day, apart from working to get ready for this, listening to folks in the community. So I had the Black Lives Matter presser this morning. I just came from the Institute of Nonviolence. At 4 o'clock, I'm leading a meeting of our Equity Council. So I don't think I will be there today, but many of my staff are, and I am fully supportive of the cause.
Where do you advise people who are coming in from outside? I know this may be a question for the mayor or for Commissioner Perry, but from your perspective, folks coming in from outside of Providence, there's really nowhere to park right now. How would you advise people participate in this rally? Everything seems to be closed down.
I would say you can find places to park. RIPTA is working. I would probably consider taking a bus in, carpooling, parking someplace and walking into the city. I mean, everything now is more difficult, candidly, but now the combination of the COVID crisis and civil unrest is really a challenge. But there are plenty of ways for people to come. Like I was saying to John, the city is open, come in early, grab a coffee, walk, take your time to walk. We're going to do our best to, make it so that people can participate.
Governor, you mentioned your executive orders. NEFAC, the New England First Amendment Coalition, and some other watchdog groups have asked you about lifting the APRA, the restriction on public records. When might you do that, and why haven't you responded to those letters?
That executive order is not yet expired. I think that expires in a couple of weeks, so I'll deal with it at that time. I'm open to.
Why no response to the letters?
I haven't been aware of the letters, but look, the APRA, just for folks at home who wouldn't know what that is, it allows people to have access to public records. I have been very transparent and going to continue to be committed to transparency due to the fact that my team is incredibly busy. We haven't changed anything that makes that lessens access to public records. What my executive order did was give us some more time to respond. And so I'm going to look at it. And if we're in a place, we're always going to respond. We're always going to give what is required by law. We often go above and beyond. All we said was that we needed a little more time to do it since everybody's super busy. So I hear you. I'm for transparency. If we think we can get rid of the extra time, I will. So I haven't really studied it yet. I think it doesn't expire for 2 weeks.
Governor, this morning, that was quite extraordinary with the leaders of Black Lives Matter. Mm-hmm. And in talking to them afterwards, they complimented you on you listening to them and getting a sense of their perspective. Mm-hmm. In your conversations with them, you touched on it, but what really stood out to you that it was not a perspective you shared before you sat down and really listened with them?
I just, first of all, I should say, I'm not new to this work. I didn't just wake up a week ago realizing that we need to commit ourselves to racial justice. Now, haven't been perfect, and there's a lot more to do, and I'll be the first to recognize all there is to do. But Brother Gary and I have had dialogue for years, right? And we've been working together on, the Promise Program, raising the minimum wage, criminal justice reform. I'm so proud that I, as governor, led on criminal justice reform. So the thing, though, to answer your question is, it's just the more time I spend talking to him and other people in the community, as I've been doing more and more, Black people in the community, it's just amazing how profoundly they feel unheard and how real that is and how real their fear is. It's just, the more you listen, the more you realize, like, man, we're doing a terrible job listening, you know, as a society, as leaders, as people who aren't of color. Like, God, we are just not hearing them. We are not hearing their anxiety, frustration, fear, daily encounters with racism. So it's just, I guess, just a more personal realization that, God, we've got a lot more work to do.
Can we just ask Dr. Scott, you're going to attend the rally, just your thought on, that was certainly extraordinary this morning, Black Lives Matter, partnership with the governor. What's the message that you're going to perhaps put out at the rally, or that you'd like to see get out at the rally, or protest, excuse me?
We want to be present, with the community. We want to help people stay safe, and also embrace the importance of raising the message, raising the point about racial injustice. It's often something that is swept under the carpet as we talk about disparities that exist and why certain communities are more impacted by COVID or domestic violence or other types of outcomes. And while our message has been, we need to look at the different environments and living conditions that people are in, and recognize the different opportunities, the disproportionate opportunities that people have had access to. And we need to, and are committed to doing better, calling out structural injustices such as institutional racism, such as many of the isms that occur, but really being able to speak clearly to the fact that people have been treated differently and have been given different opportunities because of the color of their skin, so that we can expose it, be uncomfortable in that, and use that discomfort as a motivator to make change.
Dr. Alexander Scott, would you be willing to share if you've had any experiences with racism, any here in Rhode Island in your time here and while you've been the director?
That is a personal question. As the governor shared, experiences of racism occur with people of color on a daily basis. Much of it is institutionalized racism, some of it can be individual racism, and some of it ends up being personalized racism because of what you experience day after day after day. I always appreciate sharing my mother's story. We traveled from Virginia to New York City as a young girl after her mother sadly passed away when she was 11. Went to school in New York City from through her teenage years, and was told that the high school she could go to was only one that was available for people who could not be allowed to go to college. The high school she went to only allowed for certain outcomes, but did not allow her to be the teacher or the nurse that she wanted to be, and it was solely because of the color of her skin. What I also like about that story is what she did is she went to the vocational high school that she was sent to, graduated, began working, went to college at night, continued working, went to graduate school at night, continued working, and finished by actually retiring as director of nursing with a master's degree in public administration. So she took what was there and reshaped it to become stronger. And that's what's in my own fibers and what's true to all of us as a community. How can we take what we're seeing exposed here and make it work for us to do better?
I have a question to the governor then. To follow up on the last two questions, what is it that you think has made this a different moment in terms of the consciousness, of public consciousness of racism? I mean, it could be the video, which has shocked many people, but then why did it shock people? Did it shock people because a lot of white people saw that video and just wouldn't have believed that that sort of thing existed unless they watched it in front of them? Whereas I think many black people were at least unsurprised by that video. What is it that the last 24 incidents did not produce this result and this one did?
Yeah. Listen, I'm not sure I have an answer. I do agree it does feel different. It absolutely feels different. The video was shocking, but as you say, sadly, it's not new or unique. For me, one of the things that I see different is the activism and impatience and energy of young people. And I mean young people, like teenagers and 20-somethings, younger people. And for me, it feels a little bit like what happened after the Parkland shootings. I would often say, my God, how many people have to die at the hand of gun violence before we do something? Even in our own state, I can't get the legislature to ban guns in schools year after year. And I would say to myself, what's it gonna take? And then after Parkland, the young people put their foot down and said, enough is enough, we demand action. And we did see a lot of action, even here in Rhode Island. We finally got red flag legislation passed. I feel a little bit of that now. This protest today is gonna have a heavy component of students from the Providence Public School System. In the work that we've been doing with the Providence Public School System and the state takeover, I'm hearing impatience from young people who are saying enough is enough with the racism. By the way, they're right. So I think that is a component of it, and they're pushing the rest of us appropriately to take some action. The other thing is, at the protest last weekend, it was very racially mixed, and actually mixed by age. There were people there from 10 years old to probably 90 years old. It was a beautiful thing to behold. That's different too. That is different to see the variety of races, ages, people from different communities focused on the issues at hand. And so for me, that feels different too. Look, our challenge is, okay, make the changes. It's as someone said over there, don't just talk about it, do it. So I'm not sure, I don't know why, but I know for me, it feels different.
Are you optimistic that?
I'm an eternal optimist. I think you have to be in this business. But yes, I am optimistic, and I'm anxious to work, to get going and get things done.
In what you've been hearing from members of the community in the last week to 10 days, and before that, as you said, in your conversations, what is your assessment of policing in Rhode Island? And what are you hearing from people about their own experiences, and what would you, if you had to talk to police departments and the state police and the community, do you think there's any problems in Rhode Island?
Yeah, of course there are. Excellent question though. As I said, I just came from a listening session in Providence, talking to folks who live in the community, people who've been formerly incarcerated, people who work in the community, and I asked that exact question. And I've talked to a lot of people. The general assessment is, it is better here than in many places, but we do have a lot of work to do. So there are other places around the country where you see, and I think there are other places around the country where there are bigger problems. There are bigger problems. in Providence, I can speak to the Rhode Island State Police. They have worked very hard to have good community relationships with the community, working with the community, not against the community. Are there problems still? Absolutely. Do we need more training? Yes. Do we need more diversity in the police force? Yes. Should we move towards body cameras? Yes. Do we have to do a better job of cutting down on racism? Yes. So I am, in no way am I saying we're perfect. I'll be crystal clear about that. But truthfully, I feel very fortunate. I mean, in the city of Providence, I can't speak to it. You should talk to the mayor. But by and large, they have done a very good job working with the community, as they should, to work through these issues. And we don't see some of the frequency of the brutality that you see in other cities around the country.
Governor, if I could quickly follow up, I'm just thinking back to your second inauguration, because that's when I was at, where they placed the shield around your neck and essentially.
It's called a gorget.
Pardon?
It's called a gorget.
The gorget around your neck. Are you the senior law enforcement official in Rhode Island? I'm trying to understand, I guess, the org chart, and if so, can you then single-handedly order barricades removed or the state police or National Guard to not use rubber bullets, et cetera? Is that something that falls on your desk?
Yeah. I am not a law enforcement official, so no, I am not a law enforcement official. I am the governor, and the colonel of the state police reports to me, and I am the captain general of the Rhode Island National Guard. Having said that, in the same way that I don't tell Dr. Nicole Alexander Scott to practice medicine, and I rely upon her for her public health expertise, I do not tell Colonel Manny how to conduct police business or investigations. So, but, you know, I hold them accountable, and that is my job.
Thank you, everyone.
All right, stay safe, everyone. Have a good weekend. Go out to dinner.